Vermont is a naturally beautiful and peaceful place. However, it is a place of great inequity where the majority of people are struggling to meet their needs, especially in regards to the current healthcare system. A particular example of this is how outdated and ineffective our current oral health system is, and how many people suffer from lack of oral health care and serious health issues. As Vermont builds a healthcare system to truly meet the health needs of people in Vermont, the entire oral health system needs restructuring.
Well, my name is Sheila Bannister, and I'm an assistant professor at the Vermont Technical College School of Dental Hygiene. Students spend a lot of time in clinic seeing patients that come from the community. Dental disease is pretty much 100% preventable. The patients will come to see us because they can't usually afford to get in and have preventative care done in a regular traditional dental office. It's a real difficult issue, and it's a sad thing to see over and over again.
My name is Penny Wilson and I live in Irisburg, Vermont. I do not have any dental coverage. My children have limited dental coverage through Dr. Dinosaur. No reconstructive dental care, so no braces, no crowns, no spacers or anything like that. And currently my son, who's 11, needs braces medically. That means I need to come up with $6,000 for him to get braces for his teeth to be normal. That is totally not possible for my family to do at this time. I feel really bad that my son needs braces and that he can't get them, and that we can't afford to go to the dentist.
My name is David Bushore, and I live in Burlington up on East Avenue. And currently I volunteer 4 days a week at the Champlain Senior Center. A while back I injured my back, and so that derailed essentially my income. And now I am reliant on the state assistance. Dental is not covered under that. The larger issue this year was getting a molar taken care of, which started as a small cavity. At that time I didn't have any health insurance and I wasn't able to take care of it, and it grew. But the post-sliding scale crown price was $1,000, and that was just totally unrealistic.
Well, my name's Kaya Morris, and I am the Community Health Improvement Specialist at Southwestern Vermont Healthcare. I live in Bennington, Vermont. When I moved here to Vermont, I started working for a nonprofit organization, and as many small nonprofits are in this town, in the state, they're not necessarily able to provide medical or dental benefits. I started to have some major dental issues that I needed to get taken care of, and couldn't find anyone in the area that could help me out at all. I ended up getting a really vicious abscess on one tooth and needed a root canal, but couldn't afford it.
My name is Mike King. I live in St. Johnsbury. I work at Silver Mountain Graphics. Silver Mountain Graphics is a family-owned print shop, copy shop. Actually, it's not my family that works here, but I feel part of the family, so it's my adopted family. I do not have health coverage. People that work minimum wage and up to like $16, $17 an hour, which I don't know what class that is, but that's where I'm at, and I can't afford health insurance. I don't know, I feel that I should have it, because I make pretty good money, but not enough.
A lot of these patients will wind up just having their teeth pulled because there's nothing else that they can afford to do.
Done a root canal, I guess, but that was like 5 times more expensive than just having it pulled. So I'm like, yeah, pull it, because there's no way I can spend that much money here. I can't do it.
I've seen a lot of people judge people because of their dental look, and let's face it, who can afford to go?
And if you could sit in the clinic for a day and see this, it's pretty horrific, some of the things we see. It really is. We see a lot of patients that have systemic health problems as well that I have no doubt are connected to the condition of their mouth too.
So I would have another tooth that would become a very vicious abscess and serious infection, which actually was making its way into my lymph nodes in my skull.
And it definitely impacted other areas of my life. It was a dental area, but it most certainly impacted my eating, my health.
It makes sense. The mouth is part of your body, and a lot of the first signs of illness will show up in the mouth as well.
A significant part of the healthcare crisis is the lack of access to oral health. We need to reconstruct a real oral health system. Part of this restructuring must be by creating the position of a licensed dental practitioner. This position would greatly reduce costs to patients and increase access to quality dental care in rural areas. This would be a vital piece in the puzzle of updating our dysfunctional system towards a system that puts patients first.
And what this practitioner would do would be, in Vermont, based upon a dental hygienist, so they've already had their training, they have a license as a hygienist, combined with some training as well in restorative care. Could do prevention, could do all the hygiene care, and could also do some simple restorative procedures and some simple extractions as well. Would sort of be a bridge, I think of it as, between a hygienist and a dentist, so that they could do a little bit of the work and then refer the patient on to the specialist, which would be the dentist, for anything that's more complicated.
A licensed dental practitioner would be a good idea. Why not? We have healthcare practitioners that do the same thing as a doctor. I mean, when I bring my kids to the doctors, they very rarely see the doctor. They always see the healthcare practitioner.
But it's the whole system, to me, is really skewed and almost like a dinosaur in a way. It really feels like it just doesn't work.
Had I been able to get the preventative care that I needed, had I been able to see a dentist on a more regular basis so he could have recognized that rate of decay, I might have more teeth in my head right now.
An ideal system would be a system where everyone can get the needs that they have met.
In Vermont, it would be nice if every Vermonter could go and get the braces that they need, or the fillings that they need, or the preventative care that they need.
Vermont's universal healthcare system must be based on human rights principles and must provide care for every part of our body. Experts have increasingly realized that many serious health issues develop because people lack access to oral health care. A universal health system must include comprehensive oral health.
I would like to see oral health in the new healthcare system Vermont's implementing included as just regular health. I think it's under the same umbrella. The separation to me doesn't make a lot of sense.
I feel like I don't make enough money to be healthy, which isn't right.
Healthcare should be a human right for everybody.
Medical and dental care should absolutely be a human right.
Because of the grassroots organizing of the Healthcare is a Human Right campaign, Vermont is in the process of establishing a new universal healthcare system. In order to ensure that this new healthcare system actually puts people first, then oral health must be treated as a human right.
It's going to take a lot of people pushing our system to get us there. It's not going to happen overnight, but I think if enough of us stand behind each other, it will happen.
Because I think a lot of people have stories and have experiences, or know someone who has experienced this, can connect those people, bring them together, and possibly those people together start to show the people with voting powers, the elected officials, that, hey, this is an actual problem. This is not isolated incidents. There's a lot of people, and something has to be done.